not getting as much sleep, maybe a little more stress at work or home or all the different stuff.
This is what happens in our 40s. Everybody goes through it, right?
Some people had pretty wild, like younger days. So maybe you need to check like an HIV. You might need to check like a hepatitis level.
We know that your 40s can feel like a roller coaster. You're up, you're down. Yeah, you can try to Google your way through it or ChatGPT your way through it. But the reality is you got to get in.
See a professional.
You got to get tested. Right. You got to see the professionals. Welcome to What the
Health Podcast with the Naaman Brothers.
I'm Dr. Greg Naaman.
And I'm Dr. Ted. And today we're going to be diving into the glorious decade of the 40s, where essentially things like your metabolism starts to quit on you, and your joints start to pop and lock. Everybody hears you coming into the room, and your stress levels are through the roof. So welcome to your 40s, everybody.
All right. So let's dive into it, guys. So again, why your metabolism changes in your 40s, right? That's what everybody wants to know about. And again, we know that in your 40s, this is when your body starts to make those big changes. And big changes meaning that your muscle starts to shrink a little bit, and your fat storage starts to shift, and your body, in terms of how it's shaped, starts to move. This is what happens in our 40s. Everybody goes through it, right? And part of this too is your hormones. So why does this happen? Because your hormones change at this age range.
Right.
This is when your hormones change, and of course that affects those key areas: your muscle, your fat, and how you metabolize.
It's about the hormones.
Yep, the hormones. So how do you make a hormone? Oh, don't answer that one.
Right.
So yeah, and then of course at the same time you started getting into your mental health stress. This is when people are getting burned out, because now you're not just dealing with yourself, you're dealing with this end of life and this end of life, because you're straight in the middle. You're going to have, and if you have a family and you have kids, and they're at that age range where now, again, there's some new changes going on there. And then you have your aging parents, and you got some stressors going on there. So you got these, and you're a busy professional, or you're working, and you got that stress in the middle. So now you get all that mental stress, and how do you handle that? You got to make sure you're getting proper rest, because that is also going to impact your cortisol levels, which then impact your muscles and how you store fat. These are all things that happen at this age range.
Right. So it's the time where things like, because the hormones start to dip, it's like you'll start getting like more tired, run down. Maybe for the guys, maybe they're not as sexually, active or doing that kind of stuff. For the women, it's like maybe the weight sticks on a little bit more, comes on a little bit easier. Noticing like the clothing doesn't fit as well as it used to when you were younger. All those kind of things where it's all like when you welcome to your 40s, right?
And this is the age range where we say this is why it's important to start monitoring certain labs, right? And what labs are those? Because again, every decade we have different labs that we really want to start monitoring. And like we mentioned, this is metabolism. So it's your sugar, it's your thyroid, right? The important gland
hormone
that lives
levels.
In your necks. And again, now you're talking about those, and cholesterol. Cholesterol, because of the fat shifts, your cholesterol starts to change. Right. And this is when we start seeing the precursors of vascular disease, meaning blockages in arteries in the future. This is when we start seeing that. That's why we want to start checking these labs now and making sure we're keeping an eye on those things over time, and what we can do to start shifting those stuff.
Yeah, even more important that like, sleep patterns and the amount of sleep that you're getting and the amount of exercise you're doing, all those kind of things can have a significant impact of things like your growth hormone levels and like things like your thyroid or how your body metabolizes like food or things like that.
Yeah.
Brain fog, all these kind of things that happen where if you're not sleeping well, if you packed on more weight, maybe you have some sleep apnea, now you packed on 20, 30, 40 pounds. Next thing you know, you're snoring, keeping the whole household up with your heavy snoring.
Don't
your
look
wife.
at me, man, I don't snore. But yeah, so those are the things that, again, that's what makes these 40s feel like a roller coaster. Like you're going up and down, and hey, doc, the things I've been doing before ain't working anymore. And we're like, yeah, we get that. And the reason being is because, all these levels have changed, and we got to address them. And
so a lot of great key points. So like, again, in our careers, how many times have you had people come in and Googling and saying, or like just come in and, doc, I'm feeling tired, I'm feeling run down, I'm not like the same person I was, 20, 30 years ago. And it's like, well, welcome to your 40s, and let's sit down and like, but that's the, what we do at Epic, right?
Yeah. And, again, for those who are like, hey, 40 is the new 50s or 60s or whatever it is. And we're like, yeah, that's all cool. Body still does what the body does. And we got to make sure that we're tackling those things and addressing them.
Yeah, for sure.
Come in, we'll see you, and we'll make sure that we're checking those labs. So, we just talked about, again, why your metabolism changes. Let's now maybe dive in a little bit more deeply, bro, into the role of hormones, specifically estrogen and testosterone, because we get a lot of people like, hey, what is a hormone? And then again,
what is a hormone and why is a hormone?
Right. Let's start that again.
Right.
Again, so in terms of weight, energy, and metabolism, and the mood and how it's being affected by there. So again, we know, most people know that, again, some of the hormones, we have your hormones that everyone knows about, estrogen, testosterone, but there's other hormones that people don't always think about at this age range too. That's going to be their thyroid hormone.
Sure. So maybe we'll just kind of go through a little bit of so when people talk about the different types of hormones, there are steroid type of hormones, and then there are more what we call peptide hormones. And so meaning like protein-based hormones. And so the steroid type of hormones are the ones that a lot of people normally think about as like the sex hormones. That's like testosterone, estrogen, cortisol. And those are like the ones that will do things like give, men and women their physical characteristics, breast, pubic hair, testicles, gonads, all that stuff. But that's also what
erections and why we start seeing erectile dysfunction starting to happen this age range.
And as over the years, we've recognized that there are a lot of things that can happen that just normal, like with aging and a decay in some of those cells that normally don't produce as much. So like what we see is this, like what we call andropause, where men start to decrease a little bit of their testosterone over time. For women, it's generally been noted and expected that they will lose estrogen over time in the pre-menopause, the perimenopause, and postmenopause. But in regards to the peptide hormones or the protein hormones, that's when we start talking about things like growth hormone or maybe thyroid hormone, and the different elements that come along with some of those. So,
and we know too at this age range is when people are starting to have more stress or different types of stress, and then that stress, because of cortisol levels, and it's blocking other hormone receptors inside the body, and what a receptor is where the hormone actually attaches to, and then causes the stuff inside the cell to activate. And when all these things start to happen in this age range, well, that obviously changes, like we talked about earlier, that changes your metabolism. And that changes how your body uses, so metabolism is how your body uses energy.
Sure.
And when it changes how it uses energy, then you start packing on fat cells in certain areas that we didn't do before. And now, again, your muscle starts to shrink or not to build up as fast. And that, of course, is going to impact things like your sugar and your cholesterol and things like that.
Yeah. So. And actually, and men don't really realize that women do have a little testosterone. And that's some of the main elements of that drive for women libido and their sex drive. It's that component or element of it. Whereas again, for men, that is the main driving hormone. And that's, some of those things that even just the little minimal drops in some of that stuff. For women, progesterone is another hormone that can sometimes also influence that as well. That drops in over time as well.
So it sounds like, hormones, we tackled it pretty good. We went over the different types of hormones, the sex hormones.
Yeah, maybe we should ask everybody else, why don't you, hit us up in regards to if you have any other further questions on hormones you want to know, just drop the comments and we can go over some of that as well.
Love it. So again, probably a good spot for us to then now pivot, go over to the next segment, which is really more about how all of these things now start affecting mental health at this age range.
Right. Have you guys ever hear and or complain of, I feel like sometimes I'm in fog, I don't think as well as I used to, or I always walk around and I just feel like I'm not mentally as sharp or with it as I was when I was a younger age or in my younger age. So.
Sure. And then not just only a mental fog, but you're also thinking, and we see at this age range too, their mood starts to change, right? Their how they, you maybe, and some people it's positive, they get more gratitude. And they're more mindful about things, and they appreciate things more. But then we have a subsegment of patients who it's the opposite, where everything stresses me out, and I get way more agitated than I used to, and I don't know why. I'm short, and I blow off the hand, I fly off the handle faster.
Yeah, again, a lot of that comes in when you start to get to be in your middle life, is where it's hey, body changes. Time changes, life situations change me. You're now no longer just a young, active, whatever, running around and doing all this stuff you normally want. Now you're you're probably a little more settled. You've got more regimented, you're probably a little more established in your career. not getting as much sleep, maybe a little more stress at work or home or all the different stuff.
Sure.
And all that starts to kind of build up and, starts having an impact.
Yeah. And we see this because, again, when you take a look at it from data and statistics, where we say now in this age range, you got stressors on this side of life and this side. You got aging parents and you got kids who are going through more challenges. So that's more challenging on you. And as you said, we also see that people are now at work. There's a lot of changes and shifts. And again, especially these days with AI, everything and all the changes, and it's hard to keep up while you're having all these other things and spinning plates.
Right.
With that, plus all these things that we just talked about, hormone changes, body changes, changes in terms of sleep patterns, of course, because of these different hormones and metabolic changes.
Trying to maintain that work-life balance of like, hey, too much work, not enough work, too much stuff going on in life, too much stuff going on at home.
So then how do we tackle it? So what are some tips, tricks that and pearls that we can give to the audience in terms of like what you can do around this age so that way that brain fog and that mental health doesn't start to become a crisis?
Yeah, I mean, great question. That's a great question.
Thanks.
Some of the things that I always recommend going back to the basics. It's making sure you're eating well, making sure you're exercising routinely, making sure you're getting proper rest. I mean, that in itself will always help, because if you're not doing those things, you can try to do supplements, you can try to do all the other stuff. Like, again, if you're not doing those basic core things, everything else just kind of like just goes to crap.
Completely. So again, for everyone watching and listening to this, it's the first and foremost, when you start to notice those things, if you're getting better, great, keep it up. But if you're starting to notice the things that you don't like about, again, the 40s, then this is a good time for you to start thinking, all right, I got to go back to the basics, build my infrastructure. I got to get my 8+ hours of sleep. I got to make sure that I'm balancing life, work and home. And energy balance is important right now.
Yeah. So again, if you guys want or discuss or have more questions about elements of like mental, energy, brain fog, not thinking right, drop some more comments. We'll be happy to discuss more.
Let's do it. So now probably is a good time for us to then change in terms of the conversation over from the mental side of things, right? The brain, the computer that controls everything, to now the things we just talked about. So in terms of the lifestyle stuff, this is the basic fundamentals, the lifestyle medicine that we always go back to. This is as we mentioned, it's the foundation of everything. And typically this is when we see that people in this age range, they've shifted and they don't necessarily adhere to the foundations. So it's a good time to get back into practice. And you mentioned some of them, bro, earlier. But what can they do in terms of lifestyle shifts that actually work for them? Yeah.
So making sure, try to balance that work life. So that way, when you're getting up, I always say recommend, it should be 7 days a week, getting up the same time every day. Ideally should be early.
Yep.
Make sure that you've got your daily routines, which means like eating your specific patterns and eating the type of the macros and micros. That's a little complex, but meaning, get into the routine. Get up same time every day. Make sure you're eating good, healthy, quality meals. Make sure that you're getting proper rest and try to get to bed at a consistent time, so that way you can create, because as the way our bodies were designed was it needed to have that routine. It needed to have that clock and that cycle, that rhythm pattern.
Habit setting is a good time to go back. And if you haven't set a good habit or routine for yourself or a discipline, this is a good time to start working on that. And again, that goes back to the fundamentals: proper rest, proper nutrition, proper exercise. It's the 3 pillars, right? The 3-legged stool. And again, proper rest, meaning you got to get your 8 hours in, go to sleep at the same time. It's a good time to start journaling. If you're not doing that, again, start doing some mindfulness and journaling before you go to bed. Hey, what really worked well for me today? What do I want to improve tomorrow? It's a good habit to get into. And then, of course, it's when you do these things, you become a better role model. And you start seeing that, things start to fall into place. And that body composition we talked about earlier, that's why it gets back to where it was, because we're starting to reduce our cortisol level, the stress. We're starting to improve our metabolism and our blood sugar levels. And that whole work-life balance, it's work-life metabolism and energy balance is really what you're looking for. So you got to balance your energy. You're not going to be able to balance life. That's just impossible. So what you want to do is balance your energy at this point. Your lifestyle should shift so that way you're balancing your energy level.
Yeah, and it all kind of comes out to, there are many people who are in their 40s and they don't have like 5 kids that they got to go take care of and whatever. But it is like if they're
Yeah,
burning the
5
midnight
kids,
oil, right? They're burning the midnight oil. They're up all night. They're partying, all that kind of stuff. It's going to catch up to them. Or
absolutely.
again, they've got the 3, 4, 5 kids, and they're working their like 18 hours a day and whatever. It's going to catch up to you. So you got to balance life. Everything in life has got to be balanced.
And everybody always asks us, that's all cool, but what about supplements? What supplements should I take at this age? And I say, we'll talk about it some other time. Let's move on to the next topic, which is really at this age range. What should we be testing? What should patients be coming in for? What should the average person out there in this age range, what should they be coming in for and saying, hey, doc, I really need this tested, or the doc, when they tell them this, it's not hitting them out of left field?
That's a great question.
Yeah, it's 2 today.
How did you get out of medical school? So, great questions. The labs that, individuals need to get, I mean, there are some labs that are just routine, everybody should get every year. And then there are some labs that are based upon symptoms, like, hey, we only check really if you have specific symptoms. Yep. And then there are, labs that we might want to maybe do based upon like the individual and if they want to go above and beyond. The majority of that is like left for like, hey, then you got to go fighting with the insurance guys. But if we say just everybody across the board, there's some general things. We're going to want to know things like your cholesterol level. We're going to want to know things like your blood sugar level. We're going to want to maybe understand other elements of at least make sure your kidneys and your liver and your blood counts routinely are good. Yeah. We might maybe even take it up a notch and check some things like maybe your thyroid level. But then if you want to get a little more specific, if you're having some symptoms of like the brain fog or the erectile dysfunction, or you feel like, hey, my periods are being really off, or I'm like all of a sudden getting a lot of mood swings or things like that, we might want to check other type of labs. So maybe you can talk about some of those.
Great. Yeah. So exactly. So again, back to the conversation we were having earlier, where we're talking about, again, this is a good time because of those changes. It's to get some baselines, understand where your estrogen levels are, where your testosterone levels are. And as you mentioned, women have testosterone and estrogen. It's not just men who have that. And same thing with guys, again, it's the ratios we're looking at, of course. And then above and beyond that is going to be, because if your body is starting to change, what is your thyroid level? Where are you at with that? Cortisol, of course, cortisol is controversial because, again, people, the best, of course, 24-hour urine cortisol, but and you can do the swab cortisols. Just checking a serum cortisol one time, it's not meaningful because it fluctuates, so quickly in your bloodstream that it's not meaningful to check at a blood test.
Even testosterone can fluctuate.
Right. It's also not just testing those, but it's a good point. Good point.
Yeah, thanks. I got one.
Yeah, you got a good point there. You should wear a hat. But it's a good time for us to talk about the timing of these tests. It's not you're going to be testing, any time of the day. You can just walk in. You want to make sure that you're testing it. Now you can screen for those tests, and then if they come up normal, don't be surprised when your provider says, you can come on back in, and we're going to want to test it at a specific time to see really what it is at this nadir or this time period. So those are the things that we really say, again, from a screening perspective or lab testing in this age range, especially if you're starting to have those symptoms we talked about earlier,
sure,
with sleep and changes in body habit or body structure. That's we want to test those other things beyond that.
Yeah, and there could be other, depending on how crazy of a life that you had, you might maybe need to check like an HIV. You might need to check like a hepatitis level. You might need to get like a syphilis, test just to make sure, some people had pretty wild, younger days. So
not us. We were in med school that time, but for those who
got to pay. No,
right. But yeah, and then so that goes back to there's other screenings as well. To your point, like if you had a family history of colon cancer, breast cancer, you got to make sure that we're testing those things too. So it's a good time to get all of those things tested at that age range, because we know what happens in your 50s and 60s. Well, you may not know, but you got to stay tuned, because that's going to be an episode for later where we're going to start talking about those time periods, what to expect there, and what to do there.
So stay tuned, and we'll be talking about a lot more health topics.
I think it was a good discussion, right? We know that people, you're just kind of wrap up here. We know that your 40s can feel like a roller coaster. You're up, you're down. Boy, I don't know how to feel. And
you're cricking and you're cracking.
Yeah, and things are popping, right? Your kids know you're coming at them now, that you can't surprise them any longer. So,
right.
And again, we always talk about, you can try to Google your way through it or ChatGPT your way through it, but the reality is you got to get in,
see a professional.
You got to get tested, you got to see the professionals, let them kind of see where you're at, then do the things that you need to do.
So everybody, don't forget what the
health.
And we'll see you guys back in another episode.
Right. Deuces.